Hello again, I'm Dr. David Roberts, and I'm from Manchester West Veterinary Hospital here with Cruiser, who we're going to do a mock-up on what we do for our patients to make sure that we ensure their safety during a dental prophylaxis. Because during a teeth cleaning, our patients need to be sedated. If you talk to a groomer or another veterinarian that says they don't need to be sedated for this type of procedure, it is wrong. They need to be sedated for us to do it properly, and it's not because they're bad or indifferent, it's because they need to be immobile. So what we do first is we'll start Cruiser off with some IV fluids. What IV fluids do is they help flush out his kidney and his liver, which are some of the concerns with sedation, and they also keep his blood pressure up. So he has a little IV in here, and he will be getting fluids before, during, and after the procedure. Second thing that we do is we check a blood test. We'll actually draw a blood sample, and we, just like your doctor does, we'll get tubes of blood, and we will go ahead and run those in our lab, and we'll be looking at certain things that reflect white blood cell counts, red blood cell counts. They'll actually be looking at kidney function, liver functions, protein levels, blood glucose, which satisfies our diabetic patient. So those are things that we use before we even sedate these pets. Once the pets are sedated, it's important to know that yes, they are going to have a breathing tube that will be down their throat, which will be allowing them to breathe oxygen, pure oxygen. At our clinic, we use many different monitoring devices. One is this, it's called a capnograph. A capnograph actually measures how much CO2 he is putting out through this little monitor that's hooked up to his breathing tube. So we'll actually have that down his throat. It'll be tied in, and this will be measuring his CO2 production. It allows us to tell if he's breathing or not. It's very, very sensitive. This is state of the art, what they use in a human hospital. Of course, we will have the other monitors. This is an electrocardiogram. It will have him, we have different leads here that we hook up to his legs, and it will allow us to see his heartbeat, allow us to tell if he has an abnormal heart rate or rhythm, and rhythm is being the most important part. So during a teeth cleaning, it's not just a teeth cleaning. We like to tell people that it is a dental prophylaxis. It's very important, and it's important to do it correctly. It's also important to do it by the book. So when we cleaned Cruiser's teeth in our third episode that you'll see later on, you'll see that that's exactly how we do the whole process. I'm Dr. David Roberts from Manchester West Vet Hospital. Thanks for tuning in.